Okay, so we are going to look at toilet training for all learners. We actually met Sylvia through Instagram, and I wanted to kind of help out with her program and offer some free training. So myself and Rebecca decided we wanted to provide a few different webinars to support families during these difficult times. So I am Teressa. I am a BCBA. I specialize in autism, early intervention services, and in-home services. Rebecca is a BCABA. She specializes in parent education, early intervention, and adaptive skills. So we're going to go through today's training. In the chat box, I included a toilet training data sheet for you to have and to keep to help you through the process of toilet training if you're ready to begin. Ultimately, we'll be going through the training and discussing all the facets of toilet training. And then basically walking you through some different methods, different strategies that you can utilize with your child. So we'll kind of go back and forth. We're going to try to get through it and leave some room at the end for questions. But if you have like a quick, easy question that we can answer, you might be able to type it into the chat, and or myself or Rebecca will try to respond to you. If it's something that's bigger, we might wait a little bit longer towards the end. If it's something super specific, we will give out our emails at the end so that you can email us and ask a really specific question, because I know sometimes there are really interesting cases and really interesting situations in regards to toilet training. So for our agenda, we're going to talk about if your child's ready. The idea of a kid being ready is always, what comes up for most parents. We're going to talk about some barriers, so some challenges, where to prepare your kid and how to start. We're going to talk about reinforcements, how you kind of continue that behavior. We'll also talk about some methods and strategies, tips and tricks, and then again, we'll leave some time for questions. I do have references that we can share with you too in regards to like books and some of the articles that we read. So those will be available too at the end of the slides. When we discuss potty training with our families, we work with kids from 0 to 3. We have a lot of families who want to begin potty training. Especially when COVID hit, we had so many families who were saying, I have all this time, I'm at home, this would be the perfect time for us to do toilet training. And we agreed. We said, yeah, that's an awesome idea. But we didn't take into account that there's a lot going on for families right now. So, concerns about employment and the economy and politics and just day to day, there's a lot going on, especially with families who have multiple kids who are home. Now we're also assisting with remote learning. So ideally, the process of training your child to go in the restroom and to toilet train could be a really simple process, or it could be a difficult process, because it is something that your child can control and they have the ability to control it. This is where things get a little bit challenging. So I put this quote in here that we can teach your child to potty train. We can teach them the steps, but we can't necessarily force them to go. And I think that's the hardest aspect for parents is, my kid knows all the steps, he understands what's supposed to happen, but he hasn't gone yet. And this is typically where a lot of our parents give up, or they feel unsuccessful, or they just want to call it quits. I want you guys to know that this is a very common problem and issue with families. So it's not something that we can give you a timeline for and say you can potty train in less than a day, which there is a book that I will reference that talks about toilet training in less than a day. But mind you, this was done in a clinic, and it was done with doctorates following these kids and guiding parents through this toilet training process, which is not real. It's doable, but it's not realistic, especially not today. So going through that piece, I want parents to know that it's definitely a process. It's definitely going to take some time. So we're going to talk about some of the prerequisites, some of the skills that your child should have. Now, say that they should have it. When I say that your kid should have a prerequisites for toilet training, the idea of this prerequisite piece is more so it's beneficial. You don't necessarily need all of these prerequisites, but some of these prerequisites could help you in that process of toilet training. They could help speed it up. They could make it more understandable for your child. So there's some things that you want to think about. So one of the things that would be good for your child to have is staying dry for 1 to 2 hours. This is typically why we don't recommend starting toilet training at around 6 to 9 months, because those babies are going constantly. They don't stay dry for that long of a period. So staying dry for 1 to 2 hours is something that you want to look forward too. Another concept would be sitting on the toilet for a few minutes. So some of our kids, especially children with autism, with sensory issues, typically are very fearful of sitting on the toilet. They are sitting on top of this big bowl. There's bright lights. There might be a fan in the bathroom. You want to think about that piece. Can my kid sit on the toilet for just a few minutes? The next piece is they might show some discomfort or awareness that there's something in their diaper. So kids who kind of fuss or tug at their diaper, kids who are uncomfortable and shifty when they've got something or they've soiled themselves, they'll often, we have the kids who go hide in the corner, or you have the kids who come and stand near you when they've got something stinky and you can smell it. So that's always another good sign, because they're showing that they want their diaper changed, that they're not comfortable sitting in it. The other piece is following simple directions. So again, not necessary, but it is beneficial for you to say, let's go sit on the potty, and your child to understand what the potty is. For you to say, let's sit down, or let's wash our hands. Those simple directions will help in that process. But again, it's not necessary. We can prompt and guide kids through a bulk of the steps for potty training, but the last piece of having them actually void, we can't physically make them do. The last piece is regular bowel movements. So we have a lot of kids with gastrointestinal issues, kids who don't have regular bowel movements, are constipated, so it takes them longer when they have to sit on the toilet. So those things are definitely something that you want to consider, and we'll talk about some ways that you can work around some of these prerequisites. We'll talk about some ways that you can overcome some of these challenges. So again, they are some of the most recommended prerequisites, but we've seen in our field that you don't necessarily need that piece to jump into toilet training. You don't have to wait for all of these boxes to be checked. So the next thing we'll talk about is what we can do if we're missing some of these skills. So if you're looking at a lot of these skills and you feel like my kid's nowhere near here and we're not ready yet, or you are wanting to expose your child but not jump right in, there's some things that you can do to start introducing them at a young age. So changing their diaper often is important. You don't want your kid to get comfortable sitting in a soiled diaper, because then it becomes normal, it becomes regular. So oftentimes if a kid is too comfortable sitting in their diaper, we tell parents to change it more often, to check it more often. You want to talk about their bowel movements or when they do soil themselves. So as you're changing diapers, you want to say, oh, you have poo-poo, you have pee-pee. You want to just narrate, so that way your child understands the sequence of events. For those kids who are hiders, we will label it and say, oh, you're going potty? Okay, mommy won't look. Because it kind of lets them know that we are aware that they're going, and we're indicating to them this is what your body's doing. Other things you can do is modeling toilet training, which is so funny because a lot of our parents are probably the most uncomfortable with this piece, but just allowing your kid to be in the restroom while you go to the restroom and see how it happens. This is one of the most underused strategies, but it's definitely one of the easiest ones, to just allow your kid watch you, watch dad, watch older siblings, and see that this is a normal part of daily living. If your child does have bowel movements that are irregular, we typically recommend that you talk with your pediatrician, your doctor, even seeing a gastroenterologist if it is something that is a more severe case. Having those irregular bowel movements can affect your training schedule, can affect your baby or your child being able to realize that that bowel movement is coming. So this is definitely a big piece and can kind of make toilet training difficult. Other things you can do is monitoring your, sorry, my screen just separated. The other things you can do is monitoring your the food intake. So what foods your baby's eating, what drinks they're drinking, those will always affect bowel movements. The second thing we can do is working on functional ways for your kid to communicate. So a lot of our families struggle with, my child doesn't tell me that his diaper is soiled. My child doesn't indicate that they, need to use the restroom or that they have a bowel movement. So in this situation, we work with families on just having the child indicate they need a diaper change. And it doesn't need to be a word. It can be a sign. It can be a gesture. It can be laying down on a changing table or where they are normally changed. It can be them retrieving a diaper to say that they need the diaper change to occur. So it doesn't necessarily need to be full communication. So looking at that piece, then we wanted to move into some of the common barriers. So Rebecca is going to go through what things you should expect to run into and what your common barriers are going to be as you jump into this journey of toilet training.
Hello. So typically when we are in the field, these are the main common barriers that we see with children, and we definitely have ways of overcoming them. So your first one is your communication. Um, every child's mode of communication is different. Some children may be nonverbal, some may have vocalization skills. So that is something to consider. If the child is not yet vocalizing, then we want to think about what are other ways that we can get that child to communicate that they need to use the toilet, right? Your second piece is your anxiety and sensory related fears. This is something that we often see, like Teresa mentioned. It's a new experience for a lot of kids. It's not typical that we sit on a seat with the hole. Even the flush of the toilet might be something that's scary. So, those are fears that we have to be mindful of and learn to overcome them prior to starting the potty training. Motivation is another one. Some kids may not be motivated to go potty. So we want to make sure that we're building that interest. And later on, we'll go into different like strategies that we can work on increasing motivation for children and using reinforcers. Your last barrier that we sort of touched on was your health issues. So again, it's not a prerequisite to have regular bowel movements, but it's something to consider as part of that may make it a little bit more difficult for to really start that potty training sequence and getting them into the routine of it. Because if we can't determine when they go consistently, it's hard to catch them in the act. So it's something that we want to make sure that we rule out as like a medical concern for potty training with the doctor. So moving forward, we're gonna go over overcoming these barriers. So the first way for the communication is if a child isn't vocalizing that they need to go potty, we have other ways, right? We can use PECs or visuals. A lot of families that I work with, we do this. If they're not using any, they don't have any vocal skills yet, we create a little potty card and we teach them to hand that potty card to parents to go initiate to go sit on the toilet using gestures, right? They can tap their diaper, they can use the potty sign or the toilet sign to indicate that they need to go potty, or using the AAC devices so they can create a sentence on there or push that potty button to indicate to parents that they need to go. Your next one for your anxiety. So this one's a big one. I think this is something that we always really have to overcome with a lot of children. So there's a lot going on in those bathrooms. There's, different sounds. Every bathroom may be different. The sound of the flush may be different from one toilet to another. The lighting might be different from one room to another. So the biggest thing is working through that is through exposure, right? We do little by little, several times a day. We go to the bathroom, whatever it is that they're fearful of. We just do very small durations of exposure trials for that. Using social stories, can be individualized to every child. We'll go more in detail as to what they are later, but they're really great to read prior to potty training so they know like why it's fun and what it is. Modeling, like Teresa mentioned, it's something that we don't really think about, but children learn by observing others do things. So if you're not comfortable modeling for it, older siblings can do it. A lot of kids are motivated by their older siblings to sit on the toilet because they want to be big kids. And then also thinking about muting sensory experiences. So if maybe the lighting or maybe the fan that goes on in that restroom is scary, maybe we just don't turn it on, or we try a different bathroom with dimmer lights, but it doesn't have a fan, so it makes it a more welcoming experience for them. And then practicing with sitting with the clothes on. So some kids are just being bare bottom with that hole under them is scary. So we just start slowly with practicing with their pants on, and then once they get comfortable, it's just sitting with their pants on. We work on taking their pants off, leaving the diaper on, and then eventually bare bottom. Motivation, some ways to work on increasing motivation for kiddos is to use the exposure, getting them used to those sounds and what the potty is, making it fun, making it a very fun and great thing to do, and even adding in your pretend play with toys. So If they like cars, if they like dinosaurs, maybe we put the dinosaur on the potty and then they try sitting. So it makes it a little bit more welcoming for them. And then lastly, if there is some help, like if there is some irregular bowel movements, just making sure we see the doctor or the gastrointestinal doctor to rule out any medical concerns, and then as well as monitoring the diet and food your children eat is big. So if you have a kiddo who loves bananas, bananas often make people constipated, and so that can affect their need to go to the bathroom. So that's something to consider in terms of their food and diet. Okay, and then Teressa will go over how to prepare for potty training.
Okay, so in the preparation phase, we want to look at how you get started and how you prepare. So it's different for every family. Some families just want to start with exposure, just want to take it slow. You don't feel like you're in any immediate rush. Your kid's not going to start daycare or school at any time. So you just want to start with some simple exposure. So simple exposure, again, modeling. Social stories are another great tool, and we'll talk more about them in depth as we go into some of those strategies. But it's basically just walking your kid through a story of what going potty looks like. So they have different Elmo books, they have different social stories online that you can print for free or you can purchase. I don't always recommend purchasing because it can get very costly when we're talking about toilet training materials. You can just talk to your child about it. Brother's going in the potty. He's doing great. Look at him. Now he gets to go outside because he went pee-pee in the potty. You guys can use videos. So there's videos in terms of cartoon videos that show the process of toilet training to normalize it for our kids. And then just like Rebecca said, pretend play. So a lot of research recommends using a doll, using a, Mickey Mouse plush, basically walking your child through it. So if we just wanted to start with exposure, your kid's really young, or you feel like he's not ready, or let me see if he has any aversions, he's going to be scared of anything, or we're going to run into any issues, this is a good place just to start. A lot of our families with kids around the 18-month range will kind of start here in just the exposure piece. Even just saying, do you want to try and sit on the potty today like mommy? Is something simple. You can expose them to it, but you're not requiring it. You're not pushing them to make it happen right then and there. It's just, let's see where we're at and let's see if they're comfortable yet. When we talk about preparing, I want to stress the importance of the environment. So Rebecca talked a little bit about that environment and the lighting and the sounds and the things that are available. But really setting up your environment can really make or break the intervention. If you don't have the tools in place and the things that you need for toilet training ready, it could definitely hinder your process. It could cause more frustration for you. And ultimately, for a lot of our families, it ends up, getting them to that unsuccessful point where they just want to give up. So definitely making sure that your environment is set up is important. So let's talk about some of the environmental setups. So one of them is modifications. So modifications might be if your child is sitting on the potty, a modification might be a step stool so that their feet don't dangle, because that typically makes most kids uncomfortable. And sitting like that with your feet dangling and the weight will eventually kind of mess with your legs and your blood flow. So you want to have a seat prepared for your child. Other modifications could be, my child doesn't like to dry his hands with towels, so we use paper towels. So I have to have paper towels in the restroom. Other modifications could be the lighting. We're going to change the lighting up, or we're going to make sure the fan's off in the bathroom when he's in there and it's not on. So looking at different modifications that you might have to make the environment more inviting for your child. The potty or the seat. So this often comes into question. A lot of parents will ask us, what do you recommend? Do you recommend the potty, the small little potty that I have to clean out and it's a mess, or do you recommend the seat? I know as a parent, most of our parents want to do the seat. It's easier, it's less messy, but it is scary for your child to sit on that seat. And if they don't feel comfortable, then you run the risk of you're done right then and there. Your kid's not even going to sit on that. The potty is always nice. They have different potties out there. They have ones that look like adult potties and they flush. They have a variety of, an Elmo potty, a mini potty. So some of those are nice because your child can pick. I always say that you want to allow your child to pick. You want to allow them the opportunity to choose, because if it's something that they choose, they're going to like it more. They're going to be more interested in it. They're going to want to engage with it. So potty or seat is more of a preference situation. It's not necessarily like this is what's recommended or this is what's going to show um, the most success in potty training. You want to have items in reach. So we'll talk about reinforcers. We'll talk about, having those items to deliver to your child if they need a distractor. But you want to have those items in reach so that way you don't have to run around or, not be present for your kids sitting on the toilet. Especially for the young ones, it's scary to leave them there alone. You worry about them playing with the water or flushing the toilet excessively. Rolling all the toilet paper out. It gets crazy if you don't have anything in reach. Other items that you might want to have in reach are timers or visuals. So if you're using a visual schedule, which we'll talk about, or you want your kid to sit on the potty for at least 2 minutes, you want that timer there. So that way you can put it on and you can have that timer run out and your child can hear it and they understand. But if you don't have that timer available, again, you're running around. We'll talk about how to use those timers a little bit more. And then the reinforcers need to be there. If you are reinforcing your kid for going in the potty with M&Ms, your reinforcers have to be in the bathroom, and you have to make sure you don't run out of those M&Ms, because if you run out of those M&Ms, you're going to run into a really big behavior because you promised M&Ms for going in the potty and he worked really hard to make that happen. So just make sure that you have those things in the environment set up, ready to go. This is another discussion that typically comes up with parents. And again, it is a preferential discussion. It is, per parent and per family's needs. But it is something that I want to make sure that we educate families about. So the issue of diaper or underwear. So when a lot of parents begin potty training, we often want to do it in the easiest way, and we want to keep them in diapers because if an accident happens, you want it to be clean and you want it to get caught. But the research shows that kids who continue to wear diapers during toilet training typically, on average, will take longer to toilet train. The reason that happens is because that diaper becomes that safety net. That diaper becomes that cue for them to release, to let it go, right? So this typically is, I recommend to parents, if they're gonna go, sorry about that. This, my mail keeps popping up. There you go, is that better? Okay, so if parents are typically trying to do this whole toilet training and they want to get it done quickly, they want to do rapid toilet training, the first thing that we're gonna recommend is to get rid of the diapers. If parents are taking a longer time, they're doing what we call habit training, they're getting their kid comfortable and acclimated, what we will do is we will say, okay, keep the diapers, but know that in the long run, we're going to recommend that you eventually get rid of them. In the other essence of the diapers and pull-ups, we typically still will use the diapers and pull-ups at nighttime because nighttime is a whole other training phase. So we're going to go through the training phases too, so you understand that it doesn't happen all at once. I wish it did. I wish it were that simple, but it never does. It happens in phases. So we'll go through the typical phases, but some kids will jump in and out of those phases. So that's another thing that we'll discuss and we'll walk into. So when you're getting ready to start this whole toilet training process, we always recommend doing some data. So taking some data on your kid is important because it'll show you some patterns. So a simple data sheet I put here, like an example, but I also included it in the chat for those of you who want to download it and print it or work off of an iPad with it. A lot of our tech savvy parents are awesome like that. So you want to collect baselines. So about a week of data is good because you can start to see patterns. Your kids typically wake up around the same time. They typically eat around the same time. Those schedules are important because along with those schedules, you'll start to see patterns in when they have a soiled diaper or when they have a bowel movement. If we can determine those patterns, we can use that data for a lot of things. So with that data, we can look at different patterns of the day when your child uses the restroom or soils themselves. If that happens, we can also look at how quickly after consuming liquid your child will go to the restroom. Once we have all that data, we're able to kind of determine, okay, when should we sit them on the potty? How long is my child dry for? Because again, remember, you want to aim for that 1 to 2 hours. So if they're going constantly, that may be something that we need to take a step back and look at, like, how much fluid is my kid drinking? Or should he be going this often? Or is he having irregular bowel movements because he's only going like little bits here and there? So looking at that data piece is important. I know for a lot of parents, that's not something that we typically want to do, but data is going to be big in helping to determine when you should sit your child down. So if, again, you notice it's every 2 hours or it's an hour after going and taking a drink, then 15 minutes before we'll sit them down for it. So you're going to use that data in the long run. Rebecca is going to talk about your reinforcers and getting those ready. Oh, I think she's on mute, Sylvia, again, because it doesn't allow you to unmute the host. There you go.
Hi, sorry. Okay, so reinforcers. Reinforcers are really important with the potty training. Reinforcers help increase the behavior, may be maintained over time. So we'll go over some different types of reinforcers that we can try. The biggest thing to think about reinforcers when we're using it to motivate children to go to the potty is that they're idiosyncratic, meaning that every person's or child's reinforcer is different. So what might work for one kiddo may not work for the other one. So this is where you guys, parents, know your child best, so you know what your child is motivated by. When we think about reinforcers, we have this like silly little acronym in the ABA world. It's called EATS. So it stands for edibles, activity, tangible, sensory, and social. So those are the types of reinforcers we have. So edibles are like your snacks or your candies. Activities could be going outside, doing some music and dancing. Tangibles could be your cars, your little fidget activities. Sensory could be painting, Play-Doh, slime. And then social could be your praise, right? Your high fives and you did it, good job. So those are the types of reinforcers we that you can choose from. Just depends on your child. For the most part, we always suggest like candy, right? Or something that's a preferred snack or something small, like a small toy. So some things to consider with reinforcers are that you want to think about an item that can be either consumed in a short amount of time or has an end. So if you give a child an M&M, there's an end to it, right? And he doesn't get it all day long. If we have cars or we do a little bit of Play-Doh, there's some end to it that at some point they become bored of that car or that Play-Doh and they move on to something else. Something that's a little bit more difficult to probably transition away from is your tablets. It's what we normally see, your iPads, tablet time. It's harder to transition away because it is considered a too high of a reinforcer sometimes, which means that when you want to end it, maybe you only want to give your child 5 minutes of tablet time after potty training, or maybe only 2 minutes. Transitioning away can trigger behaviors. And so then that in turn makes it less likely for the child to want to engage in potty time the next day. So that's something to really consider. If it's too high, we don't want to use it because then it can cause problems transitioning away from. Or if it's too low of a reinforcer, then we have to think about the size. So ways to really motivate children to work for these reinforcers with potty training is to, in a sense, deprive them. So limiting that reinforcer throughout the day. So if your child really likes chocolates, like myself, if your child doesn't have it all day and we pair it with potty training, they're more likely to want to sit and try because they haven't had chocolate all day. So that's a big thing, limiting it so that they want to work for that chocolate with potty training. On the other side of the deprivation piece is your satiation. If we always use chocolate every day for potty training, at some point that becomes boring. It's not as motivating, right? It loses its value. So we want to make sure that we don't hit satiation and we vary the reinforcers if we're noticing like he doesn't want to try. Let's try something else. Let's try a different snack. Let's try a lollipop. And a big thing for a reinforcer is also your size, your immediacy, and your contingency. So the size of your reinforcer is very important. Like we said, we have some things that are too high that can cause problems with transition. and things that are too mild, maybe there's not enough, that may not motivate. So we need that middle ground, right? So it all depends on the child though. So some kids will work for one M&M and they'll sit and do the potty for one M&M. But some kids will be like, one M&M, it's not worth it. I need a handful. So that would be me, right? I love chocolate, so I'm like, I'm gonna work for this handful because I love M&Ms. So knowing how much of the reinforcer to give is important. So you want to do something in the middle. The immediacy is important in terms of pairing the behavior with the reward. So if he goes pee and that's our goal, we give that reinforcer right away as soon as he goes pee. Because if we delay it, let's say we say, okay, you went pee, good job, let's wash hands, and then I give you candy, we miss that connection. So he doesn't learn, like, the behavior of actually going potty is what gave him that reward. He pairs hand washing as a reward. So we want to make sure that the behavior that we're working on is that we deliver that reinforcer right after. And then finally, your contingency. So depending on the behavior that we're targeting with potty training is what will get that child when we will deliver that reinforcer. So sometimes when we're doing potty training, we might still be working on just like the exposure piece or tolerance. So if our goal is for the child to sit on the toilet and not necessarily go pee, then we're going to deliver that reinforcer after they sit. So then they pair that, and then we slowly expand that. Over time, we thin out the reinforcers. So at some point, if little Timmy's going to the bathroom every day, he's getting an M&M every day, we can't always have that, right? So then we say, okay, you're doing so great. Let's go potty 2 times, and then I give you M&Ms, then 3 times. And then I'm going to give you a whole bag of M&Ms if you go for 2 days. So that way we thin out the ratio of reinforcement, and so they're not so only dependent on a tangible item after every time they go. And then we still want to pair like the social piece of reinforcement. So saying, good job, you did it, or high five, you're so awesome, that was great. All of those social reinforcements we still want to use when we deliver the tangibles reinforcers, so that at some point we can stop giving a snack or a toy as the reinforcer. So we always recommend just to have like a little treasure box of reinforcers that your child might like. And that way we don't get satiated and they're motivated to like, oh, hey, I get to choose which one I want today, to make this more of a rewarding thing for them.
Okay, so next we'll talk about the methods and strategies. So I want to stress with methods and strategies, we're going to give you a few different strategies to use. We're going to give you a few different methods to try. And ultimately, we're the experts in the sense that we know that these strategies work and that there's research and data behind them. But I always stress to my parents that you know what would work for your child. You know your child's temperament, you know their behaviors, you know what types of strategies they gravitate towards. So when you're looking at these different strategies and when we typically present them to our families, we typically present them and we say, okay, based on all of this, what do you think is going to work for your child? And then from there, it's about developing like a treatment package. So I'm going to take a little bit of this and I'm going to take some of that and I'm going to implement those things. And I think that's what's going to work. There's never a one size fits all for kids. It's more so of what's going to work for your kid. So some of you who have multiple kids have noticed that toilet training with one kid was a lot easier, or your strategy with one kid was different than the next kid. I will tell you that we use a variety of different strategies in the field with the kids that we work with. And it really is dependent upon the family's needs, the child's needs, what they're capable of. So keep that in mind as we go through all these strategies. It's a personal choice. So you don't have to do everything to the T, but you want to try and follow it as best as you can. So looking at the strategies, I always think it's imperative for parents to have like a ready to begin checklist. So, we're ready to start. We've made the decision, maybe we took the weekend off, or maybe I have my week off, so I'm really going to focus on toilet training. So some of the things on your checklist that you want to make sure you have, underwear and clothing. So if you're going to go cold turkey, you want to have that underwear ready. We tell parents, go let them pick it out or have it in their favorite Puppy Pals character. Clothing is big. A lot of our kids have become super fashionable and are wearing these like skinny jeans, but skinny jeans, even for an adult, are difficult to get off when we're trying to rush to go to the bathroom. So we recommend, loose fitting clothes, joggers, sweatpants during the toilet training time. So it's easier for your kid to pull up and pull down. Cleaning supplies, because I guarantee you there will be accidents. It is rare that you have a kid who goes through the toilet training process and does it perfectly. A potty or seat, so you've made that decision, you have it readily available, you have your rewards or your reinforcers ready. So you've either got your drawer of M&Ms or you've got your treasure chest, whatever it is, you've got it ready. Your data sheet, so you've taken some data, you may even have a chart or a visual. So once you've said, okay, typically my kid wakes up at 7 a.m. and within the first 30 minutes, breakfast or not, he's got a dirty diaper. If that's the case, then right around 7 a.m. or right when he wakes up, let's just put him on the potty for a little bit. So you may develop like a schedule of at 7 a.m. I'm going to put him on the potty, and this is what my schedule is going to look like. That would be nice to kind of put somewhere that's displayable, especially if you have multiple adults in the home or you have grandparents who help with babysitting, because then it ensures that everybody's on the same page. A timer is also beneficial. I have a lot of parents who will set a timer on their phone. Especially during COVID, we are quick to lose track of time. Time will just fly and I'll be like, oh, my lunch break is over because I'm home and it's different. So just having a timer that alarms you and reminds you it's time to go ask him or go have him sit on the toilet, that's going to be beneficial as part of your checklist and to get ready. So when we talk about toilet training happening in phases, typically in the research, what typically happens is you have a phase 1, 2, and 3. In phase 1 and 2, there's 2 separate sections. So usually we will have kids who start with peeing in the toilet, and then over time they'll start to initiate going pee. So initiating would be them telling you, them indicating, or even them just walking to the restroom because they know this is what I need to do. It's a little bit, the initiating piece will always come second. Think about us as adults. Sometimes we have, a stomach ache or your stomach groans and you're like, oh, should I go use the restroom? That piece of initiating requires a lot of self-awareness and knowing your body. And that takes a little bit of time for your kids to figure out. So that won't happen right away. You may get your kid to potty and to go pee and to go poop in the toilet on a schedule, but they may not be telling you yet that, hey, mom, I need to go, or I need to go potty. That's okay. That will come secondary. So don't stress too much about that piece. Getting them to go in the toilet and to release in the toilet is the biggest success. That is the biggest hurdle that you're going to go over. And then the last phase is nighttime and generalization. So nighttime is, again, overnight. So we're talking anywhere between 6 to 12 hours, depending on how long your child sleeps, of them staying dry. This is a whole nother piece, and that's why we said we're going to focus on phase 1 and 2. And in phase 3, you may still have your child wearing diapers overnight or pull-ups overnight in the event that accidents happen, because they're still working on recognizing those cues of, oh, I need to go. So we'll talk mainly on phase 1 and 2, and phase 3 again will happen later. That generalization piece also comes into play when we're going out in the community. So going to grandma's house, going to a mall, going to a theme park, getting your kid to understand going potty is the same if we're out at Disneyland, if we're out at grandma's house, if we're out at the mall, it's all the same. So working on that piece is another component, making sure your kid still recognizes those cues when they're out in the community and they don't get so distracted by everything amazing that's happening, especially when you go somewhere like Disneyland. Your kid doesn't want to stop to go potty. So the first method that we typically recommend, so this is great for parents who want to just get their kid into the process, just introduce, this is how we start toilet training, is habit training. So you can do this with your kid who's still in diapers just to get them exposed, or you can do it with the cold turkey method. So cold turkey method meaning no diapers. So with this process, what you're doing is you're walking your child through the habit and the routine of sitting on the potty. You still take your data, because again, if I sit my kid on the toilet at 7 a.m. and he just happens to go, we get to have that celebration. We get to say, woohoo, you did it. And we get to provide the reinforcer. And then my kid makes that connection of, oh, I did it. let me try that again because that was kind of fun. So you're going to take them 10 to 15 minutes prior to that normal schedule. So that's why that data is important, because now you kind of have this schedule and you're like, okay, I should take him right around 7 a.m. I should take him about 30 minutes after he finishes his juice, because that's when we're seeing that soiled diaper. So that's where your data definitely comes into play and can help you kind of be ahead of the game. You're not playing a guessing game anymore. The other piece is to monitor fluids. So if you're doing no diaper method, I typically recommend that you keep fluids the same during your baseline week where you're taking data to the week that you start training, because then your time frames will still be the same. He will still be using the restroom at the same time. So keep the schedule the same. Whenever you gave him the juice last week, you're still going to give him juice this week, because his release will be around the same time. Sometimes when parents are doing intensive toilet training, they'll do habit training and they will increase fluid intake to get their kid to sit on the potty more, to do the process of going pee and voiding more. It's typically recommended, but it's more messy. And again, it's for more intensive. So this is if you're trying to potty train your kid in 2 days, 3 days, and you need to get it done. This is helpful because if you get them to go on the toilet more often, you get to reinforce more often. Your kid gets those successes, and now he's feeling like, okay, I could do this. So it'll happen quicker. But again, it's a personal choice. How messy do you want to get? How much time do you have, right? So again, routine is key with this. So we have to be consistent. We have to make sure that we're taking them to the bathroom regularly. So we typically tell our parents to visit the bathroom every hour and a half to 2 hours. So when you are taking your kid, you have an alarm every hour and a half to 2 hours, you're going to walk them to the restroom, have them go through the steps of toilet training. So for kids who are not comfortable sitting on the toilet, we would just be doing it in their pants and getting them comfortable sitting on the potty for maybe a minute or two, washing hands, leaving. For kids that are without a diaper and we're trying to get them to void, we'll sit them there for anywhere between 5 to 10 minutes, or sorry, 5 to 7 minutes at max. And then we will, if they go, all the better. If not, then we put back on the underwear and we try again in an hour, half or two. So again, you don't want to sit them for longer than the 5 to 7 minutes max, because your kid will get sick of it and they will definitely just be really frustrated with you. There are some studies and there are some cases in which we will do more than this, but typically you don't want to go past this. It's just a lot of time to be sitting on the potty. If an accident happens during this, so let's say your kid does go in their diaper or they do have an accident in their underwear, all you do is you remain calm. You have them practice sitting on the toilet again. We also have parents who will say, you know, poo-poo goes in the toilet, and they'll dump the poo-poo in the toilet to show the child this is where it goes, kind of giving them that practice and this is what should happen. We'll label some of those actions. You went pee-pee in your diaper, but we try not to have a big response. If you have too big of a response, it could punish your kid from, you know, the behavior of actually voiding and letting go. And it could also reinforce them going in their diaper because they think it's funny that you had this big dramatic response of, I have to clean up this mess. So you always want to be mindful of your response during the habit training piece. Dry checks is another great strategy that I typically recommend using in combination with your habit training. So let's say you're working on the habit training, your kid is not wearing diapers. In between your potty check or between your potty visits, you're going to do what we call dry checks. So you'll approach your child, you will look in their diaper, and if their diaper is clean, you'll say, oh, you got a clean diaper, you didn't go potty, awesome work, like give me a high five, here's an M&M, here's a car, here's a sticker, right? So it doesn't need to be a huge reinforcer, but you're basically saying, here's something good for your diaper being dry and you not having something in it. For the kids who are in the underwear, same thing. You're giving them credit for not making that mess. So this is a really good strategy. I gave you an example schedule. So maybe at 1 o'clock, we're sitting on the potty. And then at 2 o'clock, midway through, I'm going to check. And then at 3 o'clock, we're going to have him sit again. So he has all these opportunities to receive reinforcement and realize if I go in the potty, I get reinforced. If my diaper's dry, I get reinforced. So all of these are good opportunities to kind of increase those behaviors that you want to see your child doing. If your kid has that soiled diaper, you walk them through the steps again, put the soiled excrements in the toilet, maybe model it again, maybe have them practice sitting on the toilet again. But again, you try not to have that big response. Other strategies we utilize are modeling, books, pretend play. So we talk about modeling. if you look at a preschool setting, this one's huge. So in a preschool setting, they typically take all of the kids to the restroom. I know this is very consistent. We're in California. So in California, they do this often where they take all the kids to the restroom, and some kids are actually using the toilet and receive reinforcers. Other kids are just sitting, or other kids are just getting their diaper changed, but they don't get a reinforcer. So some kids will see that modeling and think, well, I want to do that. And they start to do it because they see their peers doing it. So modeling's big. Other ways we can do it is social stories or books. So again, there's a lot of free social stories online, but there's also, Elmo potty, Peppa Pig goes potty. There's a ton of different ways that you can walk through the potty training process with your child's favorite characters. There's also toys and dolls. So the one that I show below is an Elmo toilet training baby. So he practices sitting on the toilet. I've also seen actual baby dolls that you can squeeze their tummy and liquid comes out to kind of really show your child that cause and effect. So these are all great strategies and routines. Depending on what your child's interests are and who your child is, these are some things to consider. Another option is visual schedule or task analysis. So we have a lot of kids who use visuals, who use the PECs. Visual schedule and task analysis is a great way to kind of show your child visually what to do. So we say, okay, let's go sit on the potty, but I'm also going to point and gesture and show them the potty picture. We say it's time to pull our pants down. So we show them that picture. So on top of the verbal instruction, we're also giving them the visual. This helps with our kids who struggle with following directions, who have a harder time processing things. It gives them another way to kind of put it together. So visual schedule is also very beneficial. It also helps for parents because we are doing it consistently. The steps are always the same regardless of who implements. So if mom does it or dad does it, steps are still the same. Nothing changes. He understands and knows the routine. Token economy is another great way to do toilet training. So token economies come into play when we're trying to thin the reinforcement. So for example, we had a kid who realized that he could pee a little bit and he could save it and then come back and get another M&M and pee a little bit more. So he would go pee about 3 times in an hour, squirting out as little much as he could just to get another M&M. So once we figured this out, we put him on a token economy. So we said, you have to go pee 3 times in the potty in order to get your M&M. We also were working on increasing the amount of time that he was sitting on the potty because then eventually he just let it all go. But this was another strategy that you can use. So typically the child is working for that reinforcer. So it could be tablet time, it could be outside play, it could be M&Ms, it could be a favorite toy that he doesn't have access to regularly. And then every time he goes to the restroom, he gets a star. So once he hits his 3 stars, he gets that reinforcer. So this takes a little bit of training. You've seen it typically in school settings with the charts and sticker charts. This is just token economy is the fancy way that us ABA people call it. But very simple to implement as long as your kid understands cause and effect. This is something that you can teach your kid to work through. So next, Rebecca is going to talk about some tips and tricks, and then we'll have some time for questions.
Okay, so these tips and tricks are things that we've learned with families that we've kind of come up and thought these things work with the experience that we have with our families that we work with. The first thing I just want to mention, like Teressa mentioned, like the potty training doesn't mean that there's not going to be accidents, right? So we just have to remember that accidents are going to still happen. It's on you. It's a new routine that they're learning. So the biggest thing is walking them through those accidents as calmly as we can and just say, it's okay, we'll try again later. I know you tried to hold it, or I know you tried to let me know, but just making sure that accidents aren't like a bad thing. And that way they're more inclined to be motivated to still continue your potty routine. So still making it fun, right? We've stressed this a lot. If it's fun, it's interesting and it's motivating. So using whatever they like and their interest is exciting that we can pair with that toilet training. Another thing to think about is having some distractors while they're sitting on the toilet so they don't feel like they need to get up right away. Just like us, right? We don't go to the toilet without our phones or a book. If you do, you're reading like the back of the shampoo bottle. That's time you're not going to get back. So you want to make sure that we have some distractions to help them sit for a little bit longer. So puzzles or a book that they can read, or doing some songs while they're sitting there is great. Being patient and consistent. The consistency is really big to make it part of a routine and part of their day to day, and staying calm through some of those things, through like accidents and stuff, is important. And then remembering those phases. So daytime versus nighttime, and in the community, remembering that first we work on the daytime, having them go to the bathroom through the day, and then staying dry through the night, and then eventually expanding to different environments out in the community. Using a timer or a countdown is so great to use with to help with transitions when we're moving them away from like TV time, or maybe they're doing an activity and then we're like, okay, they have to go potty. So letting them know like we're gonna go potty in a minute, or using your timer, because then the timer is the bad guy. It's not you. You just pair the timer with potty time. I used to have a family that I worked with who mom put like timers on her phone every 45 to 50 minutes. And it was the same song that comes on. And then she would say, okay, it's potty time. It's potty, potty, potty time. So then they'd go to the bathroom. And then at some point, the kid would just hear the potty alarm and he would walk himself to the bathroom. So it just becomes like a paired signal for him. And then the big one for the direction piece is don't ask, tell. Often we find that parents ask, like, do you want to go potty? And that gives that child that choice of, no, I don't want to go, so I'm not going to go, or no, I don't need to go. But you know that they know because they're doing like a pee pee dance or they're trying to hide. So just saying like it's potty time versus do you want to go potty will help limit or help reduce the chance of them not wanting to go, and just saying it's a direction, it's not a choice. Some other tips and tricks that we have on the next slide are to allow for choices. So kids are very much, they want to be in control of their environment and they like to be autonomous. So, and that's a little bit hard, right? We want to share that control. So letting them have some choices, whether it be like what underwear you want to wear. Do you want to wear a Spider-Man or PJ Masks? You choose, and then they could put that on. Or what book do you want to read, right? Or what activity do you want to do while you sit on the toilet? That's really important so that they feel like they're in control of their environment, and it makes it more rewarding for them. Narrating what we're doing in the potty, taking pants down, you're going pee pee, flush toilet, modeling every those steps for them is important. Using simple language too, just making sure that the directions and what we're saying is short phrases versus long sentences, so that they know to pick up those context cues like potty time, sit toilet, okay, pants up, pants down, so that we're not confusing them. Using the tangibles, it reinforces with praise so that we reduce the use of tangibles and they don't feel the need to always need that to go potty. Um, there's some apps that you can download to work through potty time. Like I said, they have some alarms on there, but you can just use your alarms. Some of them are free. Some of the apps you do have to pay for, but that's always a suggestion. Working as a community, right? So if mom's implementing potty, then dad is, and grandparents, so that it's consistent all around. And then lastly is it's okay to take a break. So sometimes we start potty training and maybe the child may not be ready, or maybe we didn't consider other factors like the sensory piece or the communication. So we might have to go back. It's okay. Or we just take a break because it's not really working right now. That's totally fine. So once we have been successful with potty training, we want to plan for what we call generalization. Generalization means that the behavior occurs not just at home, but in various settings with various people and with various items presented. So how we plan for that is that we expose child to various toilets and bathrooms. So not just the downstairs bathroom or the bathroom closest to their room, but also the bathroom upstairs or the bathroom in parents' room. Then we expand to other environments. So public restrooms, grandparents' house, other family members' house, the school. Then having other family members also be part of that process. So having dad and mom, grandparents have taking this child to the bathroom so that they know that whoever takes them, they still have to do the potty training routine. Varying paces is also really important. So thinking about those several ways of saying we need to go to the bathroom. It's potty time. Let's go to the bathroom. It's time to go to the restroom. Those are all different phrases that all mean the same thing. But you want to change it and use different ones so that your child knows that it's the same action that he has to do, the same behavior based on what the phrase is. Collaborating with daycare and school so that they know that, okay, Timmy's going to the bathroom around 9:45 in the morning at home. Let's try to do that at school as well, so it's consistent and we're collaborating with everybody. And then lastly is to vary materials. So using different toilets, right? Some toilets have that cushion seat, some toilets have that harder seat, so they know that it's still potty, we can still go, but it might be different. It might be a different color. The flush of the sound, it might be different. Even the towels that we use can be, one can have characters, one can be a solid color. Sometimes we use napkins, or even the dryers, right, out in public restrooms. So just varying it and and exposing them to this will help your child generalize it, and so that they're successful in going to the bathroom wherever they are at and whoever they're with.
So in doing all this and preparing families for toilet training, we want to stress that every kid is different. With the way that one kid learns is not the same as another. You want to choose what's best. So again, we're the experts in the field of all these strategies, but you as the parent still should have a voice and still should have some opinion, because you know your child best. You spend 24/7 with them, so you know how they're going to react to some of these strategies. So that's why I say, here's everything, here's all your options. Now you as a parent will make some decisions. If you're working with therapists, or even a BCBA in home, or specialists in home, like, it's good to discuss some of these options and say, where do you think I should start, because they also have a good idea of who your child is. Toilet training takes some time, so that will require some functional communication training, especially when we're talking about that initiation piece, which, if you're interested in functional communication training, we are doing another training through United Angels Foundation, so that you can schedule and you can attend in the future to help with that toilet training process. And if at first you don't succeed, it doesn't make you a bad parent to step back and say, this didn't work, let's go back to the drawing board, or this didn't work and I need to wait home, and I need to wait until dad's home, or I need to wait until I don't have as much stress on my plate. It's not horrible to step back and think, okay, maybe we're not ready, maybe I didn't get everything set up, maybe he's still too scared and I just need to work at this level. So it's not bad to step back. I think that's a scary piece for a lot of our parents, is feeling unsuccessful. And I need parents to know that this is a process and it could take a while. And we have families, Sylvia and I were discussing, that don't potty train or have that full potty training until the age of 8. That's not horrible. It just is when your child developed that skill. Nobody's ever going to ask. Nobody's ever going to judge him based on that skill. It's just a matter of, it took a little bit longer, and you may have been troubleshooting through what works best for your child. So we do have some time for questions. If anybody has any questions, you can type it in the chat box. If you have specific questions, our email addresses are here. So if you want to email us to ask a specific question that's more related to your case, we thank you so much for joining. We want to thank United Angels Foundations for running the webinar and allowing us to present to you guys. We will be running 3 more webinars in regards to picky eating, communication training, and antecedent strategies. So those are all other great opportunities for you to continue to learn. A question came in: if we use a separate small potty, does the location matter? No. So some families do want to use the potty in the kitchen or in the living room, especially if you're a mom who's, you want to get your kid to there immediately and you want to remind them constantly that that option's there to use the restroom. So we do have some families who place the toilets in the living room or in the kitchen. Eventually, at some point, you'll have to work on fading it into the bathroom. But for convenience, a lot of our families do want to place it in a kitchen or a living room. So location doesn't necessarily matter, especially if you are noticing your kid has some aversions to the bathroom. That might be a good starting point. So that's a really good question. Any other questions? We'll stick around for a little bit longer if there's any other questions. If you have a super long question, You can take your time and type it in. I'm not sure if you're able to unmute yourselves, but we'll stick around for a little bit. And then thank you guys for joining. If you have any feedback, we would love to hear it. And we'll love to see you guys at some of our future trainings with United Angels Foundation. That would be great.
Thank you for joining.
Yeah, thank you everyone for joining us. Thank you, Teressa and Rebecca, for presenting. We are so grateful for all of this wonderful information and the resources. There is a chart that we put in the chat. If you scroll up to the very top, there's a file that you can download when you're tracking some of those times. So hopefully that's helpful. And as Teressa mentioned, we have 3 more webinars that are scheduled. We have picky eating coming up next week, and then communication and behavior. So we're really excited for this little mini series that we're doing. And you can find more information on our website or our Facebook page. We will post this video later today. It'll process, and then it will show up on our YouTube channel and our Facebook page. They're both, if you just type in United Angels Foundation, you'll find both of those. Oh, and we do have one more question that came in the chat. So my son does not walk. Is potty training something we should wait for?
Can I ask, is your son like of younger age, or is it like a disability? Is it like cerebral palsy? I want to make sure I'm working in the right range. So Holly, give me a little bit more information. Kaylee, my son is 7, and I noticed he sits on the potty and he goes pee just a little at a time and doesn't stay dry for 1 to 2 hours. It could be an indication of a bowel movement. I would even try for him, because he is going a little bit, if you're giving him reinforcement, it might be like that kid that we discussed where he is holding it and going a little bit just so he can get some of it out. You can try sitting him for a little bit longer on the toilet. You can also try monitoring his fluid intake. But I would take a look at that piece with your pediatrician to see if him going in little spurts and he isn't dry for 1 to 2 hours is something that they want to take a look at, because typically at his age, we should see them dry for that long. What kind of strategies and methods can you share or advise to a caregiver or carrier to potty train children with special needs? So we typically, that's basically what we do, is potty train kids with special needs. So a lot of these strategies are perfect. You want to think about where their cognitive skills are at, what communication skills they have, what's their form of learning. So like I said, a lot of our kids use visuals and PECs, so task analysis help out, social stories help out. In terms of rewards and reinforcement, if you're a practitioner, we typically recommend doing like a preference assessment or going through some of their really favorite activities to use as a reinforcer. For Holly, you mentioned, okay, so he's 4 and he has Down syndrome. So if he's not walking, is he using any assist, like if he's using assistive gear to get around? So I know we have kids who use the walkers or who are in wheelchairs. It's still something that you can definitely do at his age. You just have to work on him initiating a little bit more, because he's not going to be able to initiate on his own. He's not going to be able to go to the restroom on his own if he doesn't have that form of getting to there. I definitely think if he has cause and effect understanding, you can start with toilet training and you can start introducing him to it. I would touch base too with your pediatrician, and or you're probably working with a physical therapist on some recommendations they have to support him, whether it be how he sits on the toilet or what type of toilet they would recommend, because your physical therapist will be able to help in that sense too. My daughter poops in the bath almost every night. We put her on the toilet before, and she sometimes pees. She's 2.5 with Down syndrome. Tips for avoiding poop in the bath. So you can use the dry check method for the bath. So we had another kid who always wanted to pee, but only in the bath. So we would reinforce him for not peeing in the bathtub. And they would do the same. They would put him on the toilet before, but he always peed in the bathtub. Once the family started doing a bath without any pee, so they would make the bath shorter, just so that they could reinforce him and he wouldn't get the chance to pee. And then they would say, oh, you didn't pee in the bathtub, great job. And they would give him a reinforcer. So that typically helps solve it and could help with her pooping in the bath. I would also look at some of her cues. So if you are able to see some of those cues and triggers of, oh, she's squatting, she's getting ready to poop, or I see it in her face, you might be able to kind of remove her and put her on the toilet and catch it happening, or catch it midway, so that you can reinforce, like, you pooped in the toilet, great work. It's a lot of it has to do with that cause and effect and reinforcing and prompting the correct response. But yeah, that does happen quite often where kids want to go in the bathtub or they think it's funny. For our little guy, it was him watching himself going pee in the bathtub that was hilarious. Of course, thank you guys for attending. Again, if you need anything else, our email addresses are there. These are all
Thank you, Teressa. Thank you, Rebecca. You guys are great. We're really looking forward to the next webinar. So we can't wait. It'll be next week. Again, at 10 o'clock, we'll be talking about picky eating. So we hope to see some of you back. And thank you all for joining us. Thank you again, Teressa and Rebecca. Thanks for all of these resources. And we hope you guys all have a great day.
Bye, everybody. Thank you for attending.
Bye.